This is the fastest way to treat sciatica and back pain at home. Does exercise help relieve back pain and sciatica? Are not. What about chiropractors? Are not. You've probably seen this guy talk about sciatica before. Do this to overcome lower back pain and sciatica. Seems like he knows what he's talking about. This may be surprising, but exercise can actually make your lower back pain and sciatica worse. Wait, what? I do not know that. Strange, isn't it? Most people think that by exercising, you will help your body reduce back pain and reduce pain. But the reality is the other way around. You see, lower back pain is most commonly caused by a herniated disc or slipped disc impinging on the sciatic nerve. And what is a herniated disc or slipped disc? Well, years of hard work, prolonged sitting, and poor posture put a lot of harmful pressure on your spine, forcing your vertebrae to squeeze closer together. Between them are gel-like discs that act like cushions to prevent excessive strain or movement. Now when your vertebrae are compressed, the discs between them move out of place and put pressure on your static nerves. Well, understandable so far. Therefore, when you exercise, you are actually just putting more pressure on your already damaged spine. You're essentially destroying your static nerve, causing you more pain and possibly even leading to a dangerous and expensive surgery. That makes sense. So what do you do? Well, it's not about taking ibuprofen, Tylenol, and other pain relievers, because it only makes things worse. Pain relievers just stop you from feeling pain, but pain is your body's way of signaling that something is wrong. When you accidentally touch a hot stove, you will quickly feel pain and naturally withdraw your hand from the stove. What if you don't feel pain when touching a hot stove? That doesn't mean your hands won't get hurt. Of course not. You may be more seriously injured by leaving your hands on the stove for too long without realizing the danger. That's exactly what painkillers do. They mask the pain caused by compression of your static nerve, making things worse. Your spine continues to become more compressed. Your static nerve is being destroyed day by day until the time comes when surgery may be the only solution. Okay, so what should we do? Chiropractors are also not the best way to relieve back pain and sciatica, because you're forced to go 2 to 3 times a week, which costs hundreds of dollars a week, and when you stop going, the pain will return exactly how it was before. So we already know that pain relievers, chiropractors, and exercise are not the best solutions for sciatica and lower back pain. There is an easier and more effective way. Okay, let's go. About common bone and joint diseases today. He was one of the first physicians to study the connection between the deep stabilizing muscles of our lower back and spinal compression. You see, there's something deep in the lower back called the iliacus, and this little muscle is the #1 cause of sciatica and lower back pain. For such a small muscle, it causes a lot of problems. Did you know that sitting puts more pressure on the spine than standing up? And this is when the pelvic muscles are very tight. The strange thing is that right now you are actually sitting and destroying your back. And the longer you sit, the more tense your pelvic muscles become, especially if you're slouching in an office chair. One of the problems is that you cannot decompress the spine without releasing this muscle. But the biggest problem is that after more than a decade of research, Dr. James Carter has still not found a way to release tight pelvic muscles. He was losing hope, but one day, he came across a startup called Zextra Sure. They specialize in developing products using patented super-activated enzyme technology. He read through some of the notes they put on their website about the technology, and after reading it, he knew this was the answer. Soon, he cooperated with them. They really needed a doctor who could add medical expertise to their scientific knowledge. 13 months, 26 prototypes, and 5 clinical trials later, they finally invented a solution that targets the real root cause of sciatica by simulating the pelvic muscles while enhancing flow blood to the lower back and decompresses the spine. It's called Zextra Sure Joint Support Milk, and they approved it in late 2022. The secret lies in the patented super-activated enzyme technology. This helps